I'm glad the Lukash's surgery and postoperative treatment was well. I believe that now you will have a better quality of life, and this will give you the opportunity to implement your plans, do what you love, and enjoy life. I can say that to this day, despite the advent of modern drugs, surgical treatment of hypertrophic cardiomyopathy is the optimal treatment method despite the invasiveness. It has a very low percentage of complications if performed in expert centers, lower than the incidence of side effects with long-term or lifelong medications, and the effectiveness of operations reach almost 100%. No other type of treatment can be as effective as surgery. Perform surgery once and get a result for life, improve the quality of life, and reduce the risk of sudden death. This is especially important for young people with an active lifestyle. And Lukasz is a good example of such choice. I have extensive experience in performing such type of operations, and I am ready to help such patients at the cardiac surgery department of University Clinic in Białystok, Poland. Yours, Władimir Andruszczuk.
Weź może się zatłuk trochę. Weź szyję.
Spokojnie.
No nie spokojnie, tylko cię proszę.
Hello, hello. We are out of the hospital. Amazing. And this is my gift that I got from my doctor, my goodbye gift. Honestly, it's not directly after leaving the hospital. It's almost 2 weeks. I was postponing the summary for quite some time because of fatigue. I was just tired. I was getting frustrated very easily. I was forgetting a lot of things, and I couldn't find a word for something for quite some time, which is a normal thing after the surgery. That's okay. Today I feel it's a good day. It's one of the best days since the surgery. So I was like, let's do it. Let's say hello. Let's summarize my stay in the hospital. Let's summarize how I feel. Firstly, let's talk about this model, because that's one of the most bizarre things in medicine. This guy over here. Septal myectomy is, as you already know from my previous video, is the procedure which is about removing the obstruction inside the heart that grew there because of the imperfections in my genes. And this is my left ventricle, and this is the part that was removed. It's amazing because it's actually the only center in Europe that performs this procedure based on the 3D model of the heart. There are few, one in UK, one in Germany, one in Romania, and one in Italy, where they perform septal myectomy in big volumes. But the only one that uses 3D model is here in Białystok, which is kind of bizarre because I was doing my bachelor degree from physiotherapy here, and Białystok is a small city. It's not like some amazing place in Europe. It's a pretty chilled place, and to imagine that something like this is happening here is just it was just quite shocking, and I'm very happy about that, and I'm very, very happy about that I could be the patient where this thing was used, and it's because it has a lot of benefits. First of all, I was surprised how big heart actually is, and it's just half of my left ventricle. So I will add a model next to it to give you a better imagination of how big the heart is. So basically there is another half of this ventricle. There is the right ventricle, which is somewhere around here, which is slightly smaller. There are two atriums on top of each, and here there is the aorta, the artery that conducts the blood to the rest of my body. And it's just bizarre to have this model here. To imagine that I have something such massive here. I never saw heart in real person, like I didn't see the heart in full scale. The bodies that we were learning the anatomy from in Białystok, I don't remember that they had a heart. I don't think they had a heart, or I cannot recall, or I didn't pay enough attention to the heart back then. But yeah, thanks to that, I imagined the scale much better. For some reason, I always thought that the heart is smaller. The surgery was, if I understand correctly, based on the videos that I saw, maybe this one was performed differently, but based on what I saw, the entry is through the aorta. So they enter somewhere here, and from the top, they peel out those parts of the muscle that are obstructing the flow. So correct me if I'm wrong, but I think this is how it's done. Now, what are the benefits of the model? Why this surgery is so bizarre, it's so amazing, and it's why it's something that that made me decide to have a surgery here. Because honestly, I could go to any center in Europe and I would be fine with it. But this and the surgeon, his attitude towards the case, and just a good feeling about all of that made me decide to have a surgery here. Okay, the model decreases the chances of complications in few ways. First of all, thanks to the model, the surgeon knows exactly how much of the tissue must be removed to achieve perfect outflow from the heart. If too much would be removed, it risks the rupture in the septum of the heart, which happens very rarely, but it may happen. Also, what's the point of removing too much of muscle? The less is removed, the better. The second way how this model helps is it helps to plan the surgery in a way to remove those parts of the heart that are less innervated. So thanks to the model, the surgeon knows where to remove the muscle to achieve a good outflow and to remove as little as it's necessary from the areas that are very innervated. Massive part of the heart innervation goes in this wall. It's here. And as you can see, only little bit of the septum was removed from that part. Big chunk was removed from the part that was not very innervated. If electrical system of the heart is damaged in any way, it increases the chances of having arrhythmias. And arrhythmias, they require different approach. They very often require the patients to have ICD implanted. And I told the doctor that I decided for the surgery because I didn't want to have ICD. The alcoholic ablation, where they apply the alcohol to this part of the septum, has quite big risk of having the nervous system of the heart damaged. I prefer to have a scar, I prefer to have a longer recovery time, just to decrease the chance of having ICD implanted to as little as possible. If I would have to have ICD implanted, what to do? I would have to learn to live that way, to live with the box here, to live with those sensations this creates. If I can avoid it, I will do everything I can to do so. That's a good memorial. It makes me think a lot about what happened, and it makes me a little bit I don't know, I don't think there is a word for that. Now, let's talk about being discharged out of the hospital and the overall experience. Overall, it's a bittersweet experience. Sweet because from the moment I entered that ward, I felt like I'm in a good place. When I saw those people who had the open heart surgery walking circles around the corridor, I was like, it's a good place to be. It's gonna be fine. The care I received from the doctors and the nurses was amazing. I felt very well taken care of. It makes me feel like I don't only try for myself, for my wife, my parents, my friends that wish me well, but also for them. I want to take care of myself so they would also have some satisfaction of this well-done procedure. So they would treat it as a win. Because a win like this, it makes everyone feel good. As a physiotherapist, I'm also very happy when my patients achieve something and they can live pain-free. That's a massive satisfaction, and I want that for them as well. And I want that because they are good people that really care, and it didn't go unnoticed. My surgeon, he's a super cool guy. He even said a few words to the camera for my vlog, for my YouTube vlog, that have, at that moment, 3 subscribers now. What the hell? That's amazing. It's a sweet experience to be discharged from the hospital because it just feels good. It feels like a milestone was done. that from now on it will be easier, it will go smoother, and it is. The recovery outside of the hospital is better. I have more space, better sleep. I feel like a lot of stress went off me. Also, people in the ward, they are stressed, a lot of them. So you want it or not, you feel some degree of heaviness there, some seriousness of the whole situation. It's very calm there. It's a very peaceful place to some extent, but you feel some kind of a worry there, which is normal. People go through a lot there. Being out of that makes you feel lighter. So this is what I feel. I feel lighter. I feel that everything is going to be all right now. There were a few hard moments in the hospital that I will for sure talk about because it's important, but I handled that very well, and I was sure that nothing bad out of plan is happening. The experience of being discharged from the hospital is a little bit bitter because I still don't know, I didn't know, and I still don't know what exactly did I get. I feel to some extent better in some factors, but they are covered by the fatigue, by the brain fog, by the even exhaustion sometimes. I cannot test my heart right now fully, so I don't know what did I get. My parameters are better. Some of the uncomfortable sensations, like feeling blocked in my heart, like feeling sleepy when I walk, when I go for a walk, they disappeared. But I don't know how I will feel in few weeks, in few months. It requires a lot of hard work and dedication, and right now it's full of unknowns, which is a little bit stressful. When I was a physiotherapy student, I had practices in the orthopedic ward, and I was supposed to teach few basic exercises. One guy that had a hip replacement, I think he was 50, and he was very angry and shocked because he thought that after the surgery he would be almost in a few days ready to do everything he wanted. But it turned out that it will require a lot of work, a lot of training from him to achieve this pain-free life that he expected. Throughout 9 years of being a physiotherapist, I had to have around 50 solid conversations like that, explaining that the surgery is not a quick fix. Yes, it fixes something, but it will take few weeks to notice few improvements, few months to achieve quite a lot, and sometimes 1 or 2 years. And for a lot of people it's a shock because the doctors very often don't explain that perfectly. If someone doesn't have an experience like that, it can be quite disturbing to realize that later. I know that. I was expecting that. I know that the surgery is a massive stimulus. It gives me a chance to have a better life, but from now on, it's about training, it's about taking that seriously, it's about the dedication, and only those will help me to hike in Himalayas or squat 100 kg. And this bitterness, the worst thing that right now bothers me is that I don't know when I will meet the ceiling. Where is the top of my capabilities with this new heart? Hope if it will move forward, even slowly, but if it will move forward, amazing. I'm happy. But maybe I'm just a little bit worried. That's, I don't think it actually helps me to think too much about that. You have to focus on the next step, not 20 steps. So I'll just take it slowly. The good news is that the surgery really changed something positively. I can already feel that. There are better days, worse days. That's normal. One more time, I have massive gratitude towards the doctor, towards the hospital in Białystok. I'm very thankful for the fact that I was able to get there, that I didn't have to wait that long. I was waiting, I think, 2 months, which is fine. And I'm very thankful for the care that I received. It's the next level, honestly. And I wish it for everyone who have HOCM to have the care that I experienced. Okay, I got tired, so it's time for my afternoon regeneration. Usually I have only a few hours of energy in the morning, then it wears off around the afternoon, then I take a nap or go for the massage chair and use the infrared lamp. It charges me. I have then again a few hours, and then sleep. What to do? That's life in this stage. I do the plan for the day. I plan 2 or 3 things, like for example doing this video, and then I think to myself I will be happy if I will do those 2 or 3 things, and then it turns out that I do one. And yeah, it's about learning to listen to my body. If my body is telling me that it's enough, it's enough. I cannot push myself too much. It doesn't end up well. I already tried. I will for sure do the video about that as well. So take it easy, guys. I'm taking it easy. I hope you too. And yeah, here soon until the next one.